So I'm the Chief Executive of Second Steps. Second Steps been working in Bristol now for nearly 30 years, providing support and housing to people with mental health issues. So we've got some idea of what the needs are of the people that we work with, and also some of the challenges, and also what can help. And when thinking about the kind of messages I wanted to talk about today, I want to just talk about some kind of big issues to start with. And actually it's quite shocking to think that mental health services are underfunded a long way from physical health. As a society, we obviously want good services, but actually mental health services are a long way from physical health services. What's fantastic is that that people are now talking about parity of esteem, ensuring that we have the right funding for mental health that's on a parity of esteem with physical health. But actually we're a long way from that position, and what we all need to do is to make sure that mental health is really kept high on the agenda, so that we can really ensure that the next steps in terms of getting more funding into mental health happen, so that we can improve services for people, because we all want to achieve that. And secondly, we're in the 21st century, and if you think about the stigma and discrimination that people face in terms of their mental health, it's really shocking that as a society we're not able to be open about our mental health or mental well-being. And I think this is one of the biggest challenges that we face. And the question is, how do we as individuals own our own mental health, discuss with our friends and family, our work colleagues and our communities about actually mental health, because having stigma and discrimination actually is one of the biggest barriers to people accessing services, the services that they need. Only this morning I was talking to a colleague at work in our counselling services, and she was explaining that a lot of people aren't able to openly say to their employers that they have counselling sessions, that they need to take time off from work because they're fearful about the reaction that they're going to get from their colleagues and from their bosses. And we have to change that. So it's building on the work that Time to Change is happening. And also what's happened in the physical health arena around cancer, that actually the whole discussion around cancer, although there's still ways to go on that, but we have made good progress as a community and a society to be able to talk about cancer. Let's do the same around mental health. Because what we know is that actually getting in early is really important in terms of helping people with their issues, and that asking for help, giving the right kind of support, receiving help actually gives better outcomes for people. We know that. Bristol Early Intervention Service, which is a service for people with early onset of psychosis, has some fantastic outcomes because they're able to work with people at the beginning of their illness. Something like 80% of people in that service, once they finish the service, go on not needing long-term secondary care services, but get support from their GP services, which is a fantastic outcome for those individuals. The other thing that we know at Second Step, and we've talked about it in terms of a range of different things, is that social interventions, it's not just about medical interventions, that social interventions actually really do make a difference to people's health. And as we've heard from everybody, it's about being connected to your community, knowing your friends, knowing your social networks, and that all helps with people's recovery, to stay connected, to help. And we know that looking at people's housing and homelessness issues, dealing with debt, identifying if there's any domestic violence issues that are going on, or there's been any history of sexual abuse, all those things need to be thought about when we're thinking about supporting someone with mental health. So we take a holistic and a social intervention approach to supporting people to get well, because we know that it actually does make a difference. Something like 30% of people recover due to those social interventions. The other important thing that we've learned, and we're very proud of at Second Step, is about the power of peers, that actually working alongside someone with lived experience, either as a staff member or someone as a volunteer, really can make such a big difference to people's experience of services. We have been employing people in an overt way with lived experience now for 6-7 years, and we're really proud, and we're continuing to learn about actually that experience and what that means. People with lived experience can really bring a catalyst of change to people. What it means to the person using the services, they've got someone who really can empathise and has been there, and that person can bring a real experience of actually change is possible, a recovery is possible, and mentoring, and actually that they can be a symbol of hope and a catalyst for change. And that's something that we're really proud of as an organisation. And earlier this year, we were really pleased that we were able to employ someone who'd been using our services for years as in the organisation, and she's just got a job with Second Step, and she was absolutely delighted that actually that experience was actually one of the reasons that she got the job, because she was able to bring that empathy to the people that she is going to be working alongside. People can feel so isolated and also exiled because of their mental health issues, and it's really about getting people into the services that they need, but it's requiring us all as individuals, as family and networks, and as workplaces and as communities to be able to talk about mental health, that actually it's not something that people should be afraid or scared about, that the hand of friendship is there, and we've really got to break down that stigma and discrimination, and the only people who are going to do it is us, really. So that's what we need to do in Bristol.
Absolutely.
Thank you.
Thank you, Aileen.